I think one area that people would be surprised is, the range of patients or the population of patients that we care for here. A lot of people think of hearing loss as a problem associated with older adults, when in reality it can affect infants, teenagers, middle-aged folks, and adults in their older years as well. My name is Dr. Emily Patterson. I'm the audiologist here at Southwest Health Center. I think ultimately almost everybody involved in the healthcare field has a goal to improve quality of life. For me specifically, improving quality of life through communication with the world and through loved ones. My education includes a bachelor's degree in audiology and speech sciences from Michigan State University, and then I went on to Purdue University for my graduate school, where I received a doctorate of audiology. And then I completed a clinical fellowship at the Indiana University School of Medicine. I've been awarded the Certificate of Clinical Competency in Audiology. I have a license to dispense hearing aids in the state of Wisconsin, and I'm a fellow of the American Academy of Audiology. I see patients at Southwest Health Center every Tuesday and on some Thursdays each month. I think one of the rewarding aspects of audiology and helping people communicate is seeing the dynamic change within a family. Sometimes I'll see a couple or a husband and wife come in very frustrated with each other because of a lack of effective communication, or one thinks the other isn't listening or paying attention, and just seeing everybody happier and smiling and saying, oh, it's not just for him, it's really helped me too. People's expectation for how to treat a hearing loss is different depending on what their hearing loss looks like. Some people that have a mild or minimal hearing loss may have trouble hearing some talkers or hearing and understanding speech in certain situations. There are solutions for those patients. Other patients might have more of a severe, profound hearing loss, in which case they have the added difficulty of maybe hearing alerting signals, or for safety purposes need solutions that will meet their needs. So the goal, or the take home, is that there are solutions out there for everybody, regardless of what their situation is or what their hearing loss looks like. I think people are afraid to seek help with hearing loss, or maybe don't seek help with hearing loss because it often happens very gradually over a period of time. Most people don't wake up one morning and all of a sudden have a hearing loss. It typically happens little by little over a period of many years, and people adapt and adjust to it, and so they often don't realize the problem that they're having, and they don't know what they're missing. And I think a lot of times people, unless they have a friend or a family member mention it to them, or kind of push them to come in and get evaluated, they don't really even realize there's much of a problem. I think hearing aids often can provide benefit that people don't expect them to provide. For example, a patient might come in after wearing hearing aids for 2 weeks and say, I forgot that the birds make noise outside, or the birds are chirping, or I didn't realize how often I was really asking people to repeat until I didn't have to do it anymore. It can be sometimes a physical change. For example, I realized that I was really leaning forward or straining to hear people in order to understand what they're saying, and I'm able to be so much more relaxed and calm and enjoy having conversations with people that I didn't realize was difficult for me in the past.